Hello, my name is Co Mai Duong. I am a Pharmacist Candidate class of 2022 from California North State University, College of Pharmacy. Today I'm going to introduce you one of the first generation antipsychotics. It is Haloperidol with the brand name Hadol. First, there is some patient consultation points. So first thing first, what is this drug used for? Hadol is used to treat schizophrenia, Tourette syndrome, mood problem. What do I tell my doctor before I take these drugs? If you are allergic to these drugs, if you are allergic with any other drugs, food, if you have Parkinson's disease or dementia, if you are very sleepy, or if you are breastfeeding, do not breastfeed while you take these drugs. So what are some side effects that I need to call my doctor right away? Even though it may be rare, but some people may have very bad and sometimes deadly side effects when taken with this drug. Tell your doctor or get medical help right away if you have any of the following signs and symptoms that may be related to a very bad side effect, such as sign of allergic reaction, such as rash, hive, itchy, rash, swollen, blister, peeling of the skin, sign of high or low blood pressure like very bad headache or dizziness, passing out or change in eyesight, sign of liver problems such as dark urine, feeling tired, not hungry, upset stomach, sign of low sodium such as a headache, trouble focusing, memory problem, feeling confused, sometimes seizure as well, trouble of controlling a body movement, twitching, change in balance, sign of fast or abnormal heartbeat. So what are some other side effects of this drug? All drugs may cause side effects, however many people have no side effect or only have minor side effects. Call your doctor or get medical help if any of these side effects or any other side effects that they bother you or not go away, such as feeling sleepy, anxiety, dry mouth, more saliva, constipation, diarrhea, upset stomach, feeling very hungry, headache, restlessness, trouble sleeping, and pimple. So what are the indications for Haloperidol? So FDA approved for delirium hyperactive, schizophrenia, Tourette syndrome, severe behavior disorder in children. So off-label use is for agitation or aggression, acute mania, chemotherapy-induced breakthrough, nausea and vomiting. Nausea and vomiting in advanced or terminal illness, mostly in palliative care, post-operative nausea and vomiting prevention, and management of intractable hiccups. Haloperidol belongs to first generation of antipsychotic, and it is a butyrylphenol antipsychotic. It works by block the postsynaptic mesolimbic dopaminergic D2 receptor in the brain non-selectively. It also have a noradrenergic, cholinergic, and histaminergic blocking agent. Interaction. So haloperidol is metabolized by CYP3A4, so avoid concomitant with CYP3A4 inducer inhibitor. Inhibitors such as clarithromycin, erythromycin, diltiazem, intraconazole, ketoconazole, ritonavir, verapamil, and grapefruit juice. Inducers such as phenobarbital, phenytoin, rifampin, cinchona and carbamazepine. Contraindication. It is haloperidol in contraindication with hypersensitivity to the drugs, Parkinson's disease, dementia, with Lewy body, comatose patient, any condition with depression, central nervous system, and avoid with drugs that can cause CNS depression. So for pros and cons of haloperidol, the pros with the decanoate formulation is increased adherence. It has less cholinergic, orthostatic, sedative effect than other drugs in the fourth generation antipsychotic. The cons, however, the formulation decanoate may take 3 to 6 months to achieve the steady state, and it also requires oral overlap for 1 month. When it has the side effect, it's harder to treat. Dosing and administration for adult initiate from 50 to 100 milligram 3 times daily. Dose may be increased. Max dose is 800 milligram a day. For children greater than 6 years old and adolescent, initiate of 0.5 milligram per kilogram per day. Maximum dose is 50 milligram per dose and gradually increase to clinical response. And the max for this category is 3 milligram per kilogram per day. So typical antipsychotic medications such as haloperidol have a correlation with extrapyramidal syndrome due to block of the dopamine in the brain. So we have extrapyramidal symptoms such as acute dystonia, akathisia, neuroleptic Maclellan syndrome, Parkinsonian, tardive dyskinesia. And common side effects such as antipsychotic effect like elevated temperature, dry mouth, drowsiness or sedation, constipation, urinary retention, sedation, weight gain, erectile dysfunction in male, oligomenorrhea or amenorrhea in female. Uncommon side effects are haloperidol, ECG gen, photosensitivity, generalized pruritus, diarrhea, blood dyscrasia, ejaculatory problem in male. Less common such as orthostatic agitation, anorexia, constipation, length, obesity. It you a long time. Warning and precaution of haloperidol. Black box warning is increased mortality in elderly with dementia-related psychosis. Concern with disease-related cardiovascular disease, bipolar, myasthenia gravis, Parkinson's disease, thyroid dysfunction, concern related to adverse effects such as senior depression, falls. So monitor parameters for efficacy: ECG, CBC, fasting blood panel. Safety is mental status and alertness, weight, height, BMI, waist circumference, electrolyte, renal and liver function, change in menstruation, libido, abnormal voluntary movement or Parkinson's size, autonomic instability, fall risk, and ocular exam. There's no dose adjustment for renal or hepatic dysfunction. And here is my references. Thank you.